My name is Madison Green, and I will be presenting my research on the relationship between mental health and criminal behavior. Within the incarcerated population, those diagnosed with mental illness are significantly overrepresented. It comes as no surprise that there has been extensive research done on mental illnesses in an attempt to explain criminal behavior. Mental health has also become a popular debate topic due to recent mass shootings such as Sandy Hook Elementary, Virginia Tech University, and Pulse nightclub. The harmful stereotype that mentally ill individuals are frequently violent offenders or more dangerous has also affected public opinion. Many other questions have stemmed from this research. Are those with mental illness predisposed to commit crime? Does mental illness independently increase aggression? Are mentally ill offenders better off in the mental health system or criminal justice system? This presentation will look at whether there is a correlation or causation relationship and whether increasing access to mental health care could potentially reduce the risk of future criminal activity. A popular belief exists that individuals who have been diagnosed with mental illness are at a higher risk to be involved in violent and aggressive behavior. The National Institute of Mental Health estimates that 46.6 million people have mental illness. Data from studies has revealed a relationship between violence and severe mental illness. In a study conducted on prison inmates, a correlation of 80% was found between the two factors. Data from another study on juveniles found that 30% of youth that had been arrested had received mental health services. Out of all the youth, mental health service users had more arrests than non-mental health service users. The National Center for Biotechnology Information suggests that patients with mental illness may be more prone to violence if they do not receive adequate treatment, are actively experiencing delusions, or have long-standing paranoia that include conditions such as substance use disorder, unemployment, homelessness, and secondary effects of mental illness, such as cognitive impairment, can compound the risk of committing a violent crime. There are a variety of intervention programs that are used to prevent criminal recidivism among offenders who are mentally disordered, such as specialty probation, conditional release, and mental health courts. Psychiatric Mark Amberson claims that where the mental health and criminal justice systems overlap, priority should be given to the mental health system because it is in the individual's best interest to be in a hospital rather than a jail. In a study of men with Medicaid, it was found that those who lost coverage were 14% more likely to commit crime in the next couple of years. Those who had been previously treated for mental health were 21% more likely to commit crime after being disenrolled from Medicaid. The data in this study suggested that there is a strong positive correlation between losing access to health coverage and crime among men of lower income. Research on rehabilitative treatment revealed that mental health programs are effective in preventing recidivism. These services are shown to be effective because they target risk factors known to drive criminal behavior, and they are action-oriented, and they use interventions that reinforce appropriate behaviors while extinguishing inappropriate behaviors. Data from research estimates that something as short as 90-day treatment in a mental facility has the potential to prevent 10 years of prison for someone with a mental illness. Mental hospital beds per capita in the United States are lower than they have been since the 1850s. Making those services more accessible would allow for the mental health system and criminal justice system to collaborate to create the most successful treatment strategy for offenders and decrease crime. Dissenting research suggests that there may be either a different type of relationship or no relationship at all between the two variables. There is data that indicates that people with mental illness are more likely to be a victim of violent crime than the perpetrator. Studies have shown that the majority of violent behavior is not committed by those with mental illness, and the majority of those with mental illness are not violent. Research also shows that only 3 to 5% of violent crime is committed by those with severe mental illness, and only 7.5% of those crimes were directly related to their mental illness. The lead researcher, Jillian Peterson, states that the vast majority of people with mental illness are not violent, not criminal, and not dangerous. There is little to no evidence that indicates mental illness single-handedly affects crime. The significantly varying research suggests that a relationship between mental illness and criminal behavior exists, but it does not explain the majority of crime. The link between poor mental health and criminal behavior is convoluted and has resulted in extensive implications in today's society. The one similarity among all the research that is shown is that there is a need for further research and availability to mental health services. It is necessary that a variety of professionals, systems, and services collaborate to attempt to reduce or eliminate risk factors that lead individuals with mental illness to get involved with criminal behavior. I would also like to thank my mentor, Dr. Evelyn Judge, for helping me with this presentation and helping me learn more about mental health and crime. Thank you.